Patient I'll be presenting today is a 66-year-old male that's here for a follow-up to refill his Suboxone prescription. There have not been any adverse effects with the Suboxone. He has had cravings, but there's no signs of withdrawal. He's denied drug use, which has been confirmed by our urine drug screen. We looked at his ORS report, and the last time he actually picked a prescription of Suboxone up was on July the 20th, which is a little concerning because he should have been out by the time the appointment came around, and he should have been out for a while. My preceptor only prescribes for a few days at a time. So he definitely should have been out, but he reports still having them at home and taking them as prescribed as late as that day. The patient is at a high risk for relapse as evidenced by him engaging in activities and surrounding himself with people, places, and things from his quote-unquote using days. And the patient also does not follow up with individual counseling, which we've encouraged him to do quite a bit. In regard to his mood, he reports his mood is okay. Rates his depression as a 0 out of 10. His anxiety is a 0 out of 10. He has some pain in his 2 feet, which it's a chronic problem for him, but is rating it at 2 out of 10 right now. Also rates his cravings at about a 2 out of 10. In regard to his drug use history, he primarily used Percocet and fentanyl. The last use of fentanyl was on November 3rd of 2022. His total length of use is about 12 years. And he has relapsed a few times since November, but that's been with Percocet. And the last time was on, June 27th. In regard to his MSE, he's well-groomed, makes appropriate eye contact, he's cooperative, conversant, and engaged. There's no psychomotor agitation or retardation, no tremors or other abnormal movements. His speech is at a normal rate and volume. His gait is steady. He reports his mood is okay. No depression, no anxiety. The affect is appropriate. His thought process is linear and goal-directed. Thought content is normal. His perception is normal. He's alert and oriented to person, place, time, and situation. His insight is fair as evidenced by need for treatment. His judgment is fair. He's cognitively intact to conversational testing with respect to attention, orientation, fund of knowledge, recent remote memory, and language, with some mild cognitive impairment when it comes to language. He does have a little problem finding words for the most part. In regard to his active problem list, he's got opioid use disorder, chronic pain, degeneration of intervertebral disc, essential hypertension, and peripheral polyneuropathy. So in regard to the plan for today, we're looking at his urine drug screen for illicits. They were negative and was positive for buprenorphine. So we know he is taking some Suboxone, but he's not taking it as prescribed because he shouldn't have any left at home right now. We're not refilling that prescription because he states that he still has quote unquote plenty at home. We've asked him to bring what he has in so that we can, get an inventory and get back, get back on track as far as that goes. We're going to monitor for drug toxicity and compliance. Going to follow up at UTMC Recovery Services in 4 days. In regard to the insomnia, he's not been compliant with his meds, so we're not ordering anything there, and the same with his anxiety and depression. So nothing in that regard moving forward for now. Thanks.